Hello, Universal Healthcare Movement and activists all across the country. This is Universal Healthcare, the state and the nation. I'm Andre Stackhouse, and this is a re-recording of a presentation that I did for One Payer States at their Denver conference earlier this month. As I said, my name is Andre. I'm a lifelong Washingtonian. I studied information science and worked as a professional software engineer and got involved in politics through the Bernie Sanders campaigns for president. And after those campaigns, I decided that I really wanted to continue to be a political organizer, but I wanted to work on an issue rather than a candidate, and I wanted to work in my home state rather than nationally. And so that brings me to where I am today. I'm the executive director of Whole Washington. I also ran for governor in 2024. So please feel free to email me, andre@wholewashington.org, or you can book a meeting with me using that cal.com link at the bottom of the slide. And I'm happy to talk to you about the contents of this presentation, about the universal healthcare organizing you might be doing, or really any other issue you might be working on. I consider being highly available to the public and other political organizers to be one of my key responsibilities as my job as a political organizer. So, a brief introduction to Whole Washington. We are a 501c4 political nonprofit with a 501c3 coming soon. We are the largest universal healthcare group in Washington, and we're the authors of a policy called the Washington Health Trust, which is a statewide universal healthcare proposal for Washington. It is currently the only universal healthcare bill in the legislature, but we're also the only group in Washington that is actively working towards bringing this to the ballot through the initiative process. We are also members of a coalition called Healthcare is a Human Right Washington, so we consider ourselves a part of a broader fabric of universal healthcare organizing in the state. A little bit about that coalition. So it's a grassroots community labor coalition with over 40 member organizations and 20 allied organizations. Whole Washington is a dues-paying member, which means that we get to be a voting member of their steering committee. Some of the organizations that are either members or allied organizations are listed below. Depending on how familiar you are with Washington State, some of these organizations may be more familiar to you or less. But I think the point of this is that there is a great power in organizing through a coalition. There are probably organizations like this in your state. And if you're not currently in a coalition like this, you should consider joining one or starting one. And a lot of what we'll talk about today is about organizing as a coalition and spreading out, doing some division of labor between state organizing and national organizing. Some folks may remember me as a co-founder of an organization called Medicare for All Everywhere. And at the time of its founding, I think there was some question, isn't that quite a bit like what One Payer States does? So this organization was founded to build a sort of national state level movement that would bring together the work that was happening across single payer organizations in every state and coordinate them into a national movement. And that is similar to the work of One Payer States. And I just want to frame this presentation in the founding of this organization was never meant to be a criticism of One Payer States, nor was it meant to duplicate or overtake the work of One Payer States. We always saw Medicare for All Everywhere as an organization that would add something to the movement that did not currently exist. And as of today, Medicare for All Everywhere is no longer an active organization. This was the first nonprofit that I was a co-founder of, and we learned a lot through this. I built some very, very productive connections and still maintain friendships with some of the people that I met through the founding of this organization. But a lot of what I'm going to present is a sort of retread of ideas that came up through the founding of Medicare for All Everywhere. I still believe that this strategy is something that needs to be part of the universal healthcare movement. And as of today, I believe One Payer States is the best organization to carry it. So let's talk about it. But before we get into all of that, a little bit of context about the state of Washington's universal healthcare movement. First, we have a nation-leading policy. The Washington Health Trust has been introduced to the public as both a ballot initiative and as bicameral legislation, which means that there is a bill in both the state House and state Senate. We've gotten legislative commitments from Washington's legislature in the form of a universal health care commission, as well as a state single-payer resolution. So in that sense, we say that our legislature has passed two bills that commit the state to universal health care, even if they have not yet passed an implementation. We are seeing increasing Republican openness to expansions to public health care, maybe not universal health care, but approximately 20 Republican lawmakers signed a letter to Congress begging for Medicaid to not be cut. We also are seeing new congressional support for Medicare for All. So for many years, Washington only had 2 of its 12 members of Congress who had co-sponsored Medicare for All, which I think is shamefully low for a state that is as solidly blue as Washington and a state that has a progressive reputation like Washington. But with the recent election of Representative Emily Randall, we've at least gotten 1 more co-sponsor, so we're up to 3 out of 12 members. We're also getting a lot of buy-in from labor and very grassroots organizing for labor around state single payer. So we got a state single payer resolution passed through the Washington State Labor Council. And we're getting more local buy-in. We've passed resolutions through city councils, including Seattle. And if you look at the available polling, we have significant majorities, bipartisan majorities, that demand for political change on healthcare, that reject market-driven healthcare, and are even open to paying more taxes to fund universal coverage. So the question is, with all of this, what is missing? And my answer to that is we need a bigger movement. We need a more organized movement. So we need more people, and it will take us about 380,000 signatures to make the ballot. We've never been able to collect more than about a third of that. We need more money, and our estimates are to make the ballot, it would cost us about $200,000 to launch a campaign with a good shot of success, about $1 million to make the ballot, and upwards of $20 to $25 million to win on the statewide Get Out the Vote campaign. So this is big kid politics. This is the state of politics today, and we need this money to win on an issue this big statewide. We are not keeping up in the attention economy, and when you compare to a national story like Zohran Mamdani winning the New York City primary election for mayor, we can see that we have a national story with a national leader who is now being talked all the way on the other coast of Washington state, and we are just not there with universal health care. But the day that we are poised to win, it will be a national story, and there will be these national figures who are a part of it. We are uncomfortable exercising power, and so this is something that I have seen across the board, whether we're talking about nationally with the Medicare for All movement or in my own state of Washington. And I think we just need to get a little bit better at this. And I want to say that we need to get more comfortable building power, but also exercising power. And we have more power than we give ourselves credit for. It's power that we've earned, and power that we deserve. And I think that another part of this that is challenging is that really when we're talking about healthcare, it is a national issue. But because we are siloed in these state movements, it is often treated like a local issue. And so that is something that we need to change. And so I ask all of us across the board, from local to federal, from Medicare for All to state single payer, to commit to growth and building power. This is about the cost of winning on the ballot. So these are the last 4 statewide ballot initiative campaigns to come to Washington. Now, these initiatives were largely put on the ballot by, we'll call it right-wing money. And you can see that in some cases, the yes campaign outraised the no campaign. In some cases, the yes campaign wins. In some cases, the no campaign wins. In some cases, the money wins. And in other cases, the campaign that raised more money was not necessarily the campaign that won. But what all of these campaigns have in common is they raised between $6 million and $23 million. And so when we're talking about universal health care and the stakes that are at play, the amount of money that's on the line for the insurance industry and the pharmaceutical industry, we anticipate that it could be the most expensive ballot initiative campaign in Washington's history. And so we cannot afford to lowball the costs, and this is what it very well could cost to win on the ballot. But we need to be willing to face this and to walk the walk that it's going to take to get us there. A little bit about the urgency of the situation. So, in my opinion, the healthcare system of the United States has always been an emergency, but it's poised to get quite a bit worse. So, we see ACA subsidies expiring starting in January of 2026. That is very soon, and the estimates are that about 150,000 people could be priced out of the benefit exchange. We see Medicaid work requirements coming into play January 2027, and the estimates are that between 250,000 and 500,000 people could lose their coverage through Medicaid, and that the cuts from a monetary standpoint are about $4 billion, and at least 14 rural hospitals in Washington have been identified as at risk of closing. The Seattle Times has said that Washington is the #1 target in the GOP's healthcare slashing bill. That's the one big, beautiful bill. And so because we are such an enthusiastic Medicaid expansion state, those cuts to Medicaid actually have the greatest potential to create slide backs in Washington's coverage. The estimates that we see here mean that Washington could see its uninsured population double or more than double in just the next couple of years. So the situation is very, very serious. And that's why we really need a movement to reverse these trends. And so the question is, what does a nationwide healthcare revolution look like? And so as a thought experiment, I wanted to do a little case study on the Electoral College. Now, I was always taught that the Electoral College was deeply ingrained in the United States political system. It's been there since the very beginning. It's in the Constitution, and so therefore, the only way to change the Electoral College would be to amend the Constitution, which makes it not only a national issue, but one of the hardest to address national issues. And so many people will tell you that however you may feel about the Electoral College, and I personally consider it undemocratic, but that's not what we're here to talk about today. But the point is that it was not realistic to change, and that we sort of just had to accept it. We have to conform to the realities that it creates. But there's a very interesting movement called the National Popular Vote Interstate Compact. And what they noticed was if you actually look at the U.S. Constitution and the way that it describes the Electoral College, it says that each state gets to allocate their electoral votes in the way that they see fit. And so a number of states that do not like the Electoral College, which includes Washington State, have passed legislation called the National Popular Vote Interstate Compact. And what they do is they say, well, if a number of states have a majority in the Electoral College and they all agree that they would rather allocate their electoral votes to the winner of the popular vote, then we would create a de facto popular vote instead of electoral college system. And you can see that a lot of states have passed this, and just the number of states that have pending legislation to join this compact would put us over the 270 threshold of electoral votes required to determine the winner of the presidency. And so it's not, what they have done is they've found a way to address this issue not through a constitutional amendment and not through federal legislation, but instead through the states. It's not something that a state can change, but the states can change. And while this may take some time to reach that threshold, and even then we'll face court challenges, we're sure, and that there are many powerful interests that will oppose this, the point is, this is the most serious and real and practical challenge to the Electoral College, and it's coming through a movement of the states. And we have similar stories on healthcare, right? So we often talk about the province of Saskatchewan, which is not a liberal province. It is not an urban province, but it is a province that had a serious problem with healthcare that crossed across demographics, and they were able to create the first single-payer system in the world, the first province of Canada to adopt a single-payer system, and over the coming decades, that system was expanded to become the National Healthcare System of Canada. And in the United States, we have a similar story. With the Affordable Care Act originally coming from the state of Massachusetts, where it was called Romney Care, but the last significant reform to the national healthcare system really came from the state of Massachusetts. And so we think that it is very, very possible that it will be a state that puts single payer onto the map and pitches that to the federal government so that it can be considered for the next major national reform to the U.S. healthcare system. And certain people have noticed this, right? So this is a post from Dan Wetzel1, who I've never met. Don't know if they are the first person to make this observation, but the point is, this meme is something that is spreading around on social media. And what they say is, the following 15 states have Democratic trifectas. They can pass universal healthcare systems before the 2026 elections. And then they identify all of the states that have Democratic trifectas. And so we often hear from Democratic legislators that, well, we would love to pass universal health care, but we don't have a majority. The Republicans will not give us the votes that we need to pass this. But the question is, why can't we do this in states with Democratic trifectas? And I think that the logical extension of this observation is, why are we not hearing this from the most progressive members of Congress, the national leaders of Medicare for All and the universal healthcare movement, and yet they tend to be very quiet on the movements in their own states. They seem to be unwilling to provide that leadership and that pressure on their state government to act, even though it would provide coverage to all of their constituents. So, you know, I'm sure there may be some exceptions here. Bernie Sanders, back in the days of Vermont's Green Mountain Care reform, Bernie Sanders was supportive of that, but we don't hear him talk about it much anymore. I don't know that I've ever heard Elizabeth Warren or AOC or Pramila acknowledge the Washington Health Trust or the New York Health Act or MassCare. But I do want to give a shout out to Ro Khanna, who has been the primary sponsor of the State-Based Universal Health Care Act, has always been a reliable sponsor of Medicare for All, and is reliably willing to provide support, even just rhetorical support, to CalCare. And I think that that means a lot. So I've written this little statement here. We don't have the majorities to pass Medicare for All in Congress, but we can pass it in my home state, covering all of my constituents, and I am committed to leading that effort. I don't think that that should be a difficult statement for any of these politicians to say, and we should increasingly ask and expect them to provide that level of support. Now, the closest thing that we do have to this kind of thinking and this kind of movement comes from the state single-payer campaigns. And this is not a comprehensive list. Some of these logos may be out of date. I apologize for that. But the point is, from coast to coast, we have organizations that are trying to pass single-payer in their state. But I would argue that they have largely operated in individual silos and are not a cohesive movement or any kind of coordinated coalition. And that's where I think we need to get. So what does that look like? That looks a little bit more like this. So you can see we still have all of these organizations. They're working in their state, but they are supporting a national organization. And so we have those arrows going from those state organizations to one payer states, where this work really gets coordinated. But then those arrows also point back because we need that national organization to provide support to all of those state organizations. And so if we can begin to coordinate together through one payer states and with each other, we can build a stronger movement. And what would that look like, right? So there's a division of labor here between state organizations and a national organization. So where an organization like Whole Washington would be building a statewide movement, one pair of states is building a 50-state movement. Where Whole Washington is organizing on the ground and in their community, the national organization would be providing shared infrastructure that all state-level organizations can use. While state organizations would be building a close relationship to lobby their state legislatures, the national organization would be lobbying members of Congress. And only states, and not every state, but a lot of states have the ability to run ballot initiative campaigns. And so that would be those large on-the-ground grassroots campaigns. But at the national level, they would be providing strategy, campaign plans. Same with policy development. So many states do not have state single-payer policy developed yet, but one-payer states can help them develop those policies and create sets of standards so that all of these policies reach a similar level of design and coverage and can propose different fundraising approaches in every state. Fundraising needs to be shared between state and national. And then there's also local versus national actions. And so I've led a couple of Medicare for All marches in Washington. Some of them have been organized entirely locally, but they're always more powerful when they're part of a national action and when we can say that we are joining cities all across the United States. And so that needs the support of a national organization like One Payer States. I've put Fair Vote and Fair Vote Washington here as a good model for us to follow on this because Fair Vote Washington has done some incredible work and has succeeded at passing ranked choice voting in Seattle. But really only is able to do their work and exist because they have the support of a national organization. And Fair Vote has existed for a long time, and it's taken a long time to even get ranked choice voting as far as it is. But it really comes from a coordinated effort between a national organization and local chapters that have made it happen. So I want to talk a bit about some steps one-payer states can take. And so I don't like to get too into Whole Washington's struggles to maintain C4 status, but I think any organization that has and has maintained C4 status knows that it's a lot of work. And this work gets duplicated across these organizations. They all have to have their own bank account, their own treasurer, their own board of directors. And oftentimes it's a struggle to find people who are willing to do that work and who have the skills. And so through a thing called fiscal hosting that we can talk about, one pair states can provide C4 status to organizations that need it. And this is something that Whole Washington could use, but it's something that many organizations can use, and it can be the fastest way to get an organization started. So in a state that currently has no single payer movement, rather than starting by creating a C4, they could simply become a fiscally hosted C4 under one payer states and immediately start focusing on their organizing. And if you are a fiscally hosted C4, that doesn't have to be something that you're committed to the end of time. You can always, if you feel that you're ready, if you feel that you need that independence and autonomy, you would be able to spin off an independent C4. And the same goes for C3 status. And so there's a reason to have a C4 and there's a reason to have a C3. We can talk about that a bit more. But the way that it typically works is if you're a fiscally hosted organization, then you're effectively a subsidiary of the fiscal host. And in exchange for having all of your bookkeeping and your taxes and your compliance taken care of, you give some amount of your fundraising, and standard rates are between 8 to 15%, to the fiscal host, and that pays for all of the work that goes into that. One payer states can also provide shared digital infrastructure like web development, tools like Action Network, and they can find talented organizers all across the country because they are a national organization, and then connect them through online communities and digital platforms like Slack. And then they can build nationwide social media presence that can then elevate the work that's happening in every state. They can also create standards and a vetting process for state-level single-payer policy development. So these are always the questions that any state needs to answer. Who's covered? What's covered? How's it paid for? And that's something that is difficult to develop if you're starting from ground zero. But if you're an organization like One Payer States that's been around for a long time and it becomes fluent on the issue, it can be much easier for you than it might be for an organization that's just getting started. And then the last is legal review. Lawyers are expensive, and it's going to be unsustainable for every organization to have a lawyer, to pay a lawyer. And so that's the sort of thing where if we all pitch our resources together to find talented legal representation, we can all benefit from legal review in a way that would be quite a bit more affordable than paying a bunch of different individual lawyers. We can also provide political organizing tools, things like a congressional tracker or congressional report cards, also training and education. And then we need to develop more national leaders, right? And so I mentioned this earlier, but the question remains, where is AOC on the New York Health Act? Where is Pramila Jayapal on the Washington Health Trust? Where is Elizabeth Warren on MassCare? We need to provide them the support they need, the policy comfort that they need, and we need to make them feel comfortable and elevated into national leadership because we need national leadership on this issue. A little bit more about 501c3s. So where 501c4s are political nonprofits, 501c3s are charitable nonprofits, and that grants them some amount of access to fundraising that you don't have as a C4. So C3s can raise money through tax-deductible donations, and larger donations may be more accessible when they are tax-deductible. They are also eligible for employer matching programs, as well as grants. And there are some grants available to C4s, but there are way more grants available to C3s. So Whole Washington is very excited that we will soon be fiscally hosted through Sustainable Seattle, granting us C3 status, and that we will begin to start raising money through these programs. And I use Microsoft as an example because I used to work there. And Microsoft has a very, very robust employer giving program, employer matching program. And so every employee is allowed to make donations to 501c3s through this program and have Microsoft match those. And so you can see that over 720,000 donations in 2022 were raised through this program at a total amount of over $250 million. So this is how we can start to hit some of those numbers we need to hit in order to succeed on this issue. And I'm sure that Boeing has a similar program. I'm sure that Amazon has a similar program. And there are very likely employers in your state that have a program like this. And so this is why you need C3 status, and the easiest way to get it may be through a fiscal host. And it's time for us to become a coalition, and that is not just in spirit. We need to formally organize as a coalition. And so that would look like member organizations paying a due, just like with that Healthcare as a Human Right coalition I showed earlier. It means democratic governance, which is not just important, for aesthetic reasons. This is a way to create buy-in. It's a way to give organizations some skin in the game. And when they feel that they are at the table in terms of decision making, they're going to be more willing to provide actual engagement and contribution, both financially and in terms of volunteer resources. And we have talented and high engagement volunteers in every state. And so they all can contribute some amount of their time and personnel. And well-funded coalition partners may even be able to provide staff support. And so if they have staff, and it can be argued that the work for one-payer states is supporting the mission of their employer, then some of those hours can go to contributing to one-payer states. And this support can really go in both directions. And one-payer states may one day have the funds to support state-level organizations. They may have the funds to support staff that can then provide some hands-on support to state-level organizations. And so by building up each individual state organization, but having their success translate into success for the national organization, we are all going to get stronger together. And here are some specifics in how this may work. So fundraising is something that I said would be a state-national partnership. And so let's start with the observation that some states are wealthier than others. Some states are more progressive than others. Some states have more people than others. But if we were to do fundraising together and then split those funds between states, you can see how joining with other states brings us into contact with donors that we may have never had access to. And then when we split those in the end, we're all going to raise money, but what might be a little bit of money for California could be a lot of money for, say, New Mexico. What may be a little bit of money in one state can be much more meaningful money in another state, but we're all going to raise money together. We're all going to raise money that we didn't otherwise have, and a rising tide is going to lift all boats. And then what about the opposition's money? I've talked a lot about how we are going to raise more money, but our opposition has a lot of money. And so one way we can reduce the role of money in politics on this issue would be to partner with National Nurses United on their Patients Over Profits campaign. And it's a very simple pledge, and one of the things that's great about it is it spans every political office, so any candidate or elected official for any office can take this pledge, and effectively they swear that they will not take money from private insurance or big pharma or private hospitals who are organizing to privatize and get profits from our healthcare system. And so if we can make this an increasingly standard pledge that candidates are expected to take, and then we can get them elected, and then we can get them into the political offices that we need them to be in, we can eventually create a universal healthcare movement inside and outside of office that is independent from the industry money. What about ballot measures? So ballot initiative campaigns are very powerful, and a lot of the most meaningful changes in Washington that have happened in my life have happened through the ballot initiative process, and that includes marriage equality and drug decriminalization. But I put Colorado on here because in recent history, they are the one state that has actually gotten something on the ballot. It's very unfortunate that that initiative did not pass, but I want to say that many people look at Colorado's 2016 ballot initiative and say, oh, that was a failure. That set back the movement. And in my opinion, the exact opposite is the truth. So I personally was deeply inspired by Colorado's initiative campaign, and it is a huge part of what got me to become involved in the universal healthcare movement, to get involved in building an initiative campaign in Washington. And so even if you don't see it, even if it feels like a failure or a setback, it is part of our journey to winning universal healthcare in this country. And I think that it always means that we are making progress when we can get something in front of so many people and show them that in principle, this is possible. And I look at Oregon passing Measure 111 as another breadcrumb on this pathway. So Oregon passed Measure 111. It is a constitutional amendment. So in that sense, Oregon has created a right to health care on a similar level to, say, education, but they are still working on their implementation. So while it is a great accomplishment, they have not yet achieved universal health care, but I think it shows that Oregon very well could finish this work by taking it to the ballot again in the form of legislation so that the implementation is then added to that constitutional right. Washington is currently targeting the 2028 ballot. That means that we would be collecting signatures in 2027. And we are building to make this happen, and we hope that others will join us. And so one strategy we can employ through the initiative process is if we are able to put initiatives on the ballot in multiple states in the same year, that is going to split the industry's money, it's going to split the industry's attention, and even if not all of them succeed, if we can get even a few states through, that may be incredibly meaningful, and it may mark a turning point in the movement. I put Wyoming on here because they are the only state that has not passed Medicaid expansion, but which could do it through a ballot initiative. So not every state has to run the same kind of initiative, and in a state like Wyoming, we may be interested in running Medicaid expansion as a ballot initiative, and that's something that one-payer states could certainly take an interest in developing. I put Maine on here. I went to Maine to help them gather signatures for their last universal healthcare initiative, which unfortunately was during COVID and did not make the ballot. But where whole Washington has to collect something like 380,000 signatures, I look at a state like Maine and see 68,000 signatures as maybe quite a bit more possible, maybe costing quite a bit less money. And so this money can come from all across the United States. And we may target a state like Maine as one where it's a little bit more achievable in the near term as the movement grows, where it can eventually take on a state like California, where an initiative may cost millions and millions of dollars. And we can take this even one step further to a state like North Dakota. And maybe North Dakota is the Saskatchewan of the United States, because they only need 16,000 signatures to make the ballot, and they already have a public bank. And I'm not going to talk too much about public banking, but public banking can make universal health care more feasible because you can raise revenue not only through taxation, but then you can raise revenue through investment. And there are ways where when you put a healthcare trust into a public bank, less of that money is going to go towards interest and profit and go to an out-of-state financial institution. So it lowers the cost as well as raises some revenue. And so a state like North Dakota could actually be a prime candidate for universal health care. And even though it's a rural state and a red state, you'll notice that the fact that they have a public bank is a testament to the fact that in their history, there have been these moments where a very progressive idea has come through their state, and they're the only one with a public bank. So, the political boundaries that we draw around political parties do not always match what the public of any state may be ready to support. This map shows Medicaid expansion by state. And so you can see in the green, many, many states expanded through their legislature or governor. That includes my state of Washington. The ones in purple expanded Medicaid through voter initiative. And then there was a number of states that have not expanded Medicaid. And as long as they have a very unsupportive legislature or governor, it may be very difficult to expand Medicaid in those states, especially under the current political climate where Medicaid is being rolled back. But what you'll notice about those purple states that did it through voter initiative, by the way, they're purple not in the sense of being Democrat, Republican split states. They're largely red states. And yet they still wanted to expand Medicaid. And despite the fact that they did not have a supportive governor or a supportive legislature, they took it directly to their voters. Their voters wanted to do it, and that was how they got Medicaid expansion. And so I think we should never count out a state as unwilling to expand healthcare just because of it not being a traditionally progressive or a traditionally democratic state. Any state has some people who are willing to support this, and if we can organize them, if we can grow that constituency, we can win. And as we start to win, we can begin to look beyond individual states. And so this map is the United States broken up as little puzzle pieces. And the point here is it will be very difficult for the first state to pass universal health care. It will be the first. And even once they pass it, there will be challenges in terms of the maintenance of that healthcare system. But the more states that pass it, the more states that will pass it, and the easier it will get for each subsequent state. And especially neighboring states may be able to provide support to one another. And so just passing in two states that are adjacent is going to be very supportive because that begins to solve problems around things like people who live in one state but work in another state, things like medical tourism, which may happen as states pass universal health care. So even just getting two states that are adjacent to each other will be helpful. But eventually, if those states can standardize their programs, link them together, share administrative resources, they will become even stronger programs. And it's not as crazy as it sounds. Some of this infrastructure already exists. And so there are several multi-state pacts. And I was most familiar with the Western States Pact, which has Washington, Oregon, California, Nevada, and Colorado in it. But there is also the Midwest Governors Regional Pact and the Eastern States Multi-State Council. And so you can see how we could have a West Coast Healthcare Alliance or a Northeast healthcare system. It does not have to be just one state. And if we work through this infrastructure, we can develop regional healthcare systems that will be even more robust and powerful than any single state could do. And as we get larger states to come on board, eventually we'll reach economies of scale that you can imagine being expanded to cover the entire United States. I've talked about cross-state infrastructure, but let's think about things like phone banking and social media and digital tools. Every campaign builds these things up, but legislative sessions come and go, campaigns end, but the movement never needs to stop. And instead of having a campaign come to a close and having all of those organizers go and work on other issues and become disengaged from the universal healthcare movement, we can instead direct their energy and their attention to other states that still have a chance. And so if we share this infrastructure and we develop it nationally and we organize it and coordinate it, we can keep that pressure constantly there and constantly building until we are ready to win in one state and 5 and eventually nationwide. And we can even break this down to the city level. So one-payer states and whole Washington are very, very focused on state-level organizing. But one way we can develop, no state has yet developed a movement powerful enough to win statewide. And so we can begin to look at organizing through cities. And so Medicare for All Resolutions is a campaign from Public Citizen, a very, very well-established and time-honored organization. And they have been organizing this for a long time, and Seattle was the first city to adopt a Medicare for All resolution at the city council level. So it's a national campaign that organizes down at the city level, and these resolutions not only show that a municipality is ready to begin with the implementation of universal health care pending federal legislation, they can also say the same for state-level legislation. So the Seattle resolution names the Washington Health Trust specifically and says, we are ready for Medicare for All, we are ready for the Washington Health Trust, and we want to be participating in the implementation. And no matter how universal healthcare gets passed, there will always be a highly local component to it because hospitals are managed at the municipal level. So we can start with resolutions, we can start at the city level, and no city is too small, no movement is too small to begin this work at this level. But we don't have to stop there, because once we get this sort of resolution level of support and we've built a city level movement that is strong enough to get a resolution through, we can start to talk about real legislation that gets people health care. And so I have here Healthy San Francisco as well as New York Health and Hospitals, which are two municipal level implementations of healthcare systems that are quite a bit more universal than other municipalities. And so Healthy San Francisco has existed since 2007. It creates an employer mandate to cover all employees, and it also funds people who are in the Medicaid gap, so people who don't qualify for Medicaid but can't afford to buy healthcare individually. And this has survived ERISA challenges. ERISA is a challenge for any single payer implementation at the city or state level. And so Healthy San Francisco and the way that they navigated ERISA has helped us develop our ERISA workaround at Whole Washington. New York Health and Hospitals is arguably, it's quite a bit older, and it's arguably quite a bit more robust, and it works through direct care through public hospitals. And so it really shows that even at the hospital level, you can find ways to get people care who can't otherwise afford it. And so cities should be very interested in things that they can do to expand healthcare. And then we can even think at the global level. And so in 2015, the World Health Organization developed a set of sustainable development goals. And as part of that, they wanted to achieve global healthcare coverage by 2030. And unfortunately, in 2025, that's just March of this year, they announced that they do not consider the world on track to make significant progress by that 2030 deadline. And that just is the reality that we're living in. But we all can do our part in our state, in our city, to bring us closer to this goal and achieve it one day. So it's that classic think global, act local. We all have a role to play in this. But I think that we have to grasp this moment and say that now is the moment for universal health care. And I know it may feel like it's all doom and gloom and setbacks, but if we organize from the hyper-local to the global, and if we are ready to lead from the front and go on the offensive, we can win. And the urgency of the moment is setting people on fire and making them more and more willing to accept that they have to organize on this and that they have to accept that the system needs to change. And we really have them on the run. And if we embrace the power of nonpartisan single-issue organizing, we can really exercise more power and have a greater impact than we have had in the past. And so part of what that looks like is a willingness to work with people that you may have not traditionally considered working with. And it may mean working with people that you don't agree with on other issues. And we don't have to accept everything. We don't have to accept every political position of everyone that we're working with. Single issue organizing gives us the ability to set those things aside and say, we're not talking about that, but on this issue, we agree. And so if we are willing to call out political parties, whether they be our own or one that we consider ourselves in opposition to, if we're willing to work with political parties that we may consider marginal or otherwise, not in power, and if we're willing to say we are ready to set aside our differences on other issues to work on something that we do agree on, we can become a more powerful movement and win. So thank you all very much. I know it's a lot of information, and because this is not a live session, I can't answer your questions right now, but feel free to leave a question in the comments or to send me an email or something like that. Get in touch. Let me know your thoughts, and I am so excited to work on this with One Payer States and everyone out there who considers themselves part of the universal healthcare movement. Thank you.